There was a time during school that I started doing some failed vision screenings. We would go to elementary schools and we would just see kids all morning. And I realized that this was my perfect niche. I enjoy hanging out with kids all day. I like taking care of them. And I realized that there's not enough people taking care of just kids and taking care of some of the more complex cases of kids. I am an optometrist, so I work obviously with the eyes. And I specialize in pediatrics and adult double vision. We do get a lot of just general failed vision screening, so a lot of kids will go to their pediatrician and they'll fail a screening and they get sent to us. We do a full comprehensive eye exam that includes seeing them beforehand to make sure that both of their eyes are working well and both are working the same. And then we also usually do a dilated eye exam, which allows us to look inside of the eyes and then check for glasses in a way that the kids don't tell us. So I'll see kids ranging anywhere from ages 2 all the way up till adulthood. For my adult patients, we do deal with double vision, so any patient who's struggling with seeing 2 instead of 1, we try to help make them feel better. There is usually a long visit the first time we see them because we dig really deep to try to figure out what is going on with the double vision and see if there's anything else health-wise that we can help to fix the double vision, but we will also do our best to take care of them and to tweak them and to make them seeing the best that they can so that they can function in their everyday life. My day-to-day in-office procedures, I can take care of just a normal routine eye exam with a kid, but I also treat things such as amblyopia, which in one eye doesn't develop the same as the other, any type of emergency, if a kid gets a cut on the front of the eye, pain to the front of the eye, irritation, any type of allergies, and then of course any like complicated medical things. Sometimes there are genetic things that pop up, sometimes there's things inside of the eyes that we see that can be due to vision development, and all of that is kind of like a little puzzle piece that we find out during our exam. So not only do we think about like how are they functioning today in our office, but we always ask parents like how are they functioning at home? Are there certain things at home that they're concerned about? How is school going? But I'll explain to them everything that I saw today and everything that I think can benefit their kid or things that I think we don't need to worry about with their kid. I never want a parent to feel like that they're not included in their care with a kid, so I make that a really strong point in my clinic. I love to hang out with my family, so I have some nieces and nephews in the area, and then my family itself is kind of all spread out, so I try to visit them as much as I can.